This program is being brought to you in part by MedMovie. Illustrating life. Powerful visuals for health and medicine.
Additional support for the American Health Journal is provided by MindBody, the app that makes it easier to find and book your favorite classes and even salon, spa, or massage appointments. Find the top studios. Go to MindBody. In part 1 of this special series focusing on eye health and vision, we discover the newest advancements with some of the leading eye specialists, the surgeons of NVISION eye centers. First up, laser vision correction has helped millions of people have better vision.
LASIK today is not what it used to be many years ago. It's an incredible procedure.
Next, a new breakthrough called SMILE is giving patients better vision with a less invasive procedure.
As early as the first day, it is that, wow, I can see without my glasses and contact lenses.
Then, dry eye can be a minor annoyance, but for some, it's a serious health complication. There are many options that can help.
It does affect the vision, but it also affects the productivity of the patient.
Dry eyes is basically a chronic problem. One strategy alone will not actually cure dry eyes. You have to actually, it's a lifestyle change.
And resources are available for people with dry eye.
It's critical to find the right doctor who will take the time and has the knowledge to know exactly what type of dry eye you have, because your treatment will depend on that diagnosis.
Never give up hope, that there really is a lot out there that can be done, and to not give up trying.
Now, on the American Health Journal. Laser vision correction, or LASIK, has been a safe and effective procedure for patients wanting to reduce or eliminate their dependence on glasses and contact lenses for over 20 years. Now, advances in refractive surgery continue to give patients options and give hope to patients told earlier that they were not a candidate for LASIK. Dr. Tom Tooma of NVISION Eye Centers, one of the world's first and leading surgeons in surgical vision correction, gives us some history and the newest advancements.
Refractive surgery is any surgical procedure that is used to eliminate or reduce the need for glasses or contact lenses, whether that's for distance, near, or both distance and near. Refractive surgery has been around since the 60s or 70s, so it's been around for a long time. Laser vision correction became available in the United States in 1995, and that's when I started performing laser vision correction. Although before that I was part of clinical trials, FDA clinical trials, to get some of the lasers approved in the United States. So I started performing laser vision correction in the early 90s. A good candidate for refractive surgery is someone who is 18 years of age or older, who has a stable refraction. The nice thing about refractive surgery today is we have so many options that just about every patient is a candidate for something that we offer to minimize or eliminate the need for their glasses, either distance, near, or both.
Dr. Tooma discusses the newest updates in laser vision correction, including topography-guided LASIK.
So let me share with you what topography-guided LASIK is all about. We're all born with some hills and valleys in our cornea. In other words, our cornea is not perfectly smooth. What our existing technology does is it averages all those hills and valleys. Topography-guided laser takes every hill and every valley and says, I'm going to make them all even. And because of that, patients can then see better than 20/20. 2/3 of the patients see better than 20/20, one line, and 1/3 of the patients see 2 lines better than 20/20. So if you want to have the best opportunity to see even better than 20/20, topography-guided LASIK is the procedure of choice. Topography-guided LASIK has been available since 2016. It is really no different as a procedure in the way we perform it. It's a new software using existing technology. So when we did the FDA clinical trial for topography-guided LASIK, we found that on average, patients had less halos, less glare, less light sensitivity, better ability to drive at night than they had before surgery. And by the way, with Wavefront Optimized LASIK, which is the software we've had for the last 3 years, there was also a study sponsored by the FDA and the Department of Defense that also, on average, said patients did have less halos and glare at night. So the technology that we have today is awesome. LASIK today is not what it used to be many years ago. It's an incredible procedure. So everyone who's a candidate for LASIK who has nearsightedness or astigmatism is a good candidate for topography-guided LASIK. The difference is that we can get even better than 20/20 vision with topography-guided LASIK. So it's for patients who want the best as far as quality of vision day and night.
For the best vision and safety, it's crucial to find a surgeon with extensive experience.
What's important preoperatively in topography-guided LASIK is getting incredibly precise measurements. And so you have to have very experienced technicians and a very experienced surgeons who looks and interprets all this data to program the laser just perfectly so that we can end up with incredible outcomes that this procedure is capable of delivering. So the most important thing for patients when they're looking for LASIK surgery is to, number one, find the most experienced surgeon you can find, because the technology is nothing but a tool in the hands of a surgeon. So surgeon experience equals safety, technology equals quality of vision and predictability, and you have to put the two in combination to get the best chance of getting perfect vision with minimized or the lowest incidence of potential side effects.
Dr. Tooma relates a patient's story.
So I have a patient who was told by everyone they're not a candidate for laser vision correction because she developed a corneal ulcer from her contact lens wear. And by the way, the chances of an infection with a lifetime of contact lens wear is way higher than LASIK. So she was told she's not a candidate. When I evaluated her, I did find that she had a very irregular cornea because of that corneal infection from contact lenses. And so she was a perfect candidate for topography-guided LASIK because we could make that abnormal, irregular cornea into a smooth cornea, and she ended up with 20/20 vision after surgery, and obviously we were all very happy with that.
Coming up next, a look at an exciting new procedure for laser vision correction. Worldwide, 80% of the people who are blind have avoidable or curable conditions. True or false? The answer when we return.
You're watching the American Health Journal, the show that brings you the latest information on prevention, diagnosis, treatment, and research from doctors throughout the United States. Watch the American Health Journal each week on this public television station.
Worldwide, 80% of the people who are blind have avoidable or curable conditions. True or false? The answer is true. Cataracts, glaucoma, and macular degeneration are among the main causes of blindness. For over 20 years, LASIK has given hundreds of thousands of patients around the world restored vision and reduced dependence on glasses and contact lenses. Dr. Tom Tooma of NVISION Eye Centers tells us about an exciting new advancement, the SMILE procedure, which is improving outcomes and even giving hope to patients who were once told that they were not good candidates for LASIK.
So SMILE stands for Small Incision Lenticule Extraction. And so the way I explain it to patients is by contrasting it to LASIK, because everyone knows about LASIK. So LASIK is a two-step procedure. We create a flap, kind of like opening the cover of a book. If the cornea was a 500-page book, the flap is at about page 100. We then use a different laser to remove tissue from the cornea to reshape it by evaporating that tissue. We then close the flap, kind of like closing the cover of the book. With SMILE, we don't use a flap. The laser works inside the cornea to isolate a piece of tissue that we reach in and remove through a tiny little incision, and that's what reshapes the cornea. So we don't use a flap with SMILE, and therefore the acronym Small Incision lenticle extraction. So SMILE was introduced in the United States just recently and in the last few months. I was the second in California by a few hours to perform the procedure. But the beauty about SMILE, it's been available worldwide. And to date, there has been more than 800,000 procedures performed, mostly in the Far East and in Asia.
Who is a good candidate for the SMILE procedure?
A good candidate for SMILE is the same candidate for LASIK. And so if you're a candidate for LASIK, you're also a good candidate for SMILE. There are some patients that are better served with SMILE, such as patients who are involved in contact sports and patients who have been told they're not a candidate for LASIK in the past, either because they didn't have enough tissue in the cornea or because of their shape of the cornea was not very appropriate for laser vision correction.
Dr. Tooma discusses what to expect on the day of the procedure and the results.
On the day when you're having your SMILE procedure, we give you some relaxing medicine to start with. We then bring you back to the operating room. We put a few drops to numb the eye. We put a lid holder so you don't have to worry about blinking. We then use the laser, and the laser literally takes, for the whole procedure, from beginning to end, is about 4 minutes. Of that, the laser part is about 38 seconds or so. So it's a quick procedure, absolutely painless. The total time from the time you come in till the time you go home is about 2 hours. Most of it is kind of getting you prepared for the procedure itself. There's nothing you can do to mess it up, so I don't want you to worry about that. So the vast majority of our patients go back to work the next day. You will experience a huge improvement in your vision as early as the first day. It takes about a week for the vision to be excellent or incredible. But as early as the first day, it is that, wow, I can see without my glasses and contact lenses. The results have been incredibly great. The nice thing about SMILE is that patients feel absolutely nothing during the procedure, and there's that wow effect here very early after surgery. SMILE has been approved by the FDA. In the FDA study, 99% of the patients were satisfied and would recommend SMILE to a family member or a friend. The beauty about SMILE is that it's yet another procedure that we can offer our patients. And the best way for you to find out which procedure is best for you is to come in for a consultation, because it depends on many, many factors. The health of your cornea, the amount of correction that you have, the lifestyle that you have, and so it's best to find out which procedure you're a candidate for. But the most important thing is just about everybody is a candidate for something to get rid of their glasses and contact lenses. It's just waking up the next day and seeing like you haven't seen for many, many years without your glasses and contact lenses.
Coming next, resources are available for people with dry eye. If you have watery eyes, you probably don't have dry eye. True or false? The answer when we return. If you have watery eyes, you probably don't have dry eye. True or false? The answer is false. Tearing is a symptom of dry eye. When eyes are too dry, a signal goes out to make more tears. While every segment of the population has dry eye sufferers, those most susceptible to dry eye are people above age 50, especially women, contact lens wearers, people with systemic diseases, and people who have had corneal surgery. For some, dry eye is a mild irritation, but for others, can even lead to vision impairment. We spoke to the doctors of NVISION eye centers about managing dry eye disease and learned how one company, Oasis Medical, is helping patients cope with this possibly serious condition.
Dry eye affects probably every aspect of my life because it affects what we look forward to in every day. If we're feeling good, if our eyes are feeling good, then we're more apt to want to go out and do things. It tends to create depression for a lot of people because you wonder how are you going to manage your life with this condition, because it's very painful.
Many things can cause dry eye. It's multifactorial. It could be age. As a patient ages or a person gets older, your risk of dry eyes increases. It could be gender. Women tend to get dry eyes more than men, so older women have a higher risk of dry eyes than almost any other population. It could be other medical problems such as rheumatoid arthritis, lupus, diabetes. It could be environmental. For example, if you're exposed to cigarette smoking, if you live in an environment that's extremely dry, or it could be something if you take medications or certain products into your body that can cause dry eyes.
I have suffered from dry eye at least 10 years, but I had initial symptoms probably 20 years ago, now that I look back.
Dry eye can be a very difficult condition to live with. At its worst, I get headaches, I have a hard time keeping my eyes open, I blink a lot, I have a lot of pain. It feels like a foreign body is in my eye.
I suffer from dry eye mostly, almost every day, but it's varying degrees. Some days it bothers me very little, and then some days it bothers me worse. I have to say it's better now than it was 17 years ago when I first started, because I've learned ways to manage it.
So if dry eyes are left untreated, patients become more and more symptomatic as time goes on. It does affect the vision, but it also affects the productivity of the patient in that there's always the something that is bothering you all day long.
As I've gotten older, my dry eye has gotten worse, so I've had to work harder to manage it.
There's essentially two broad classifications of dry eyes. One is where you don't make enough tears, where the other one is where you're making tears but they're evaporating away too fast. And some patients can have both.
It's critical to find the right doctor who will take the time and has the knowledge to know exactly what type of dry eye you have, because your treatment will depend on that diagnosis.
When patients are going to have laser vision correction surgery, their dry eye condition needs to be addressed.
So if a person does have dry eye disease, they can have LASIK surgery, but the important thing that we really need to share with everybody is that we need to properly diagnose it, find out why they have dry eyes. And we have many tools today that diagnose why patients have dry eyes. And we have many tools to treat dry eyes. And so just because you have dry eyes doesn't mean you're not a candidate. It just means that we need to diagnose it, recognize it, treat it, get rid of the dry eyes, and then you're a safe candidate for laser vision correction.
It's important to manage your dry eye, if you do have dry eye, around the time of cataract surgery, because if you do have dry eye, that actually can affect our measurements that we take when we're calculating the lens implant powers.
Dry eyes can be the result of many things, from systemic diseases to blocked oil ducts, to eyelid issues, to hormones. For most, there is no cure, only treatment.
The strategies that we use before surgery is proper diagnosis and treatment, which includes a very high quality artificial tear, such as Oasis tears. Many of the patients that have dry eyes before also have a problem with the glands that supply the tear film with an oil layer. And again, we need to diagnose it, to treat it, so that it's never an issue afterwards.
I tell patients all the time, the best thing to do to take care of your dry eyes, drink more water, exercise, keep good eye health, which would mean wear sunglasses when you're outside, blink frequently, don't stare at the computer for hours and hours without blinking. Take omega-3s in your diet. There's great science now that shows that by taking omega-3s, supplementing that in your diet, that'll decrease your inflammatory component in your tear film and improve tear film production in general. Simple things like that will go a long way in helping your dry eyes, and it requires day-to-day management of that forever.
My eye doctor recommends a particular type of drop to me, which works so well, but it's only available from a doctor's office. It's not available in the drugstore.
I use Oasis Lid and Lash because it actually seems to take the makeup off completely. It doesn't bother my eyes afterwards, and I found that it's very effective in helping manage the blepharitis symptoms. Dry eye management isn't usually just the use of one or two things. It's a multitude of things that can make a difference in how your eyes feel.
All artificial tears are not created equally. Some are better than others. Patients who have advanced dry eyes, we encourage them to use something called preservative-free artificial tears. The reason is if you have preservatives in your artificial tear, that actually can cause a reaction on your eye that can make it red and even drier. Punctal plugs is an effective treatment for dry eyes as long as the dry eye cause is from not making enough tears. So if you're not making enough tears, you would like the tears to stay in your eye as long as possible. So we put plugs, it's called punctal plugs, either temporary or permanent. The temporary ones are dissolvable, and they'll dissolve away anywhere from 1 week to 3 months, depending on which type you use. Or you can have a permanent one, which is made of plastic, and it'll stay there until the plug falls out.
The best way I manage my dry eye is by using my drops first thing in the morning, last thing before I go to bed, throughout the day, especially when the weather conditions are windy or very dry, and I like to wear a mask to sleep.
It's just a daily regime like brushing your teeth, and that's what's kept my condition under control.
I would encourage people to go to their eye doctor for regular eye exams and make sure they ask about dry eye treatments, because the sooner you start treating your dry eye, the better your eye health will be for the rest of your life.
It is a condition that we need to treat and diagnose properly, and with proper diagnosis and proper treatment, most of our patients do achieve incredible improvement in their quality of life.
I think the most important thing when you have dry is to realize that to not give up hope, and to know that there is help out there, and there's doctors that really care, and there's doctors that know the multitude of treatments that are out there available if they just keep looking.
Coming up next, how dry eye sufferers are meeting to share information and support. According to the National Eye Institute, how many Americans age 50 and over suffer from dry eye? A, 1 to 2 million. B, 2 to 5 million. C, 5 million or more. The answer when we return.
You're watching the American Health Journal, the show that brings you the latest information on prevention, diagnosis, treatment, and research from doctors throughout the United States. Watch the American Health Journal each week on this public television station.
According to the National Eye Institute, how many Americans age 50 and over suffer from dry eye? The answer is C. Over 5 million Americans suffer from dry eye. Tens of millions more have some dry eye symptoms. The impact of dry eye diseases led one doctor from Southern California to start a support group that allows patients to share information about providers and treatments for dry eye, and to share their stories and lend encouragement.
So back in 2001, when I was a young assistant professor, I had noticed that being in Southern California, that there are a lot of patients complaining of dry eyes, and with the help of a social worker and a lot of patients who really wanted to do this, we started, I believe, the first dry eye support group in Southern California. And it still continues to this day.
The Orange County Dry Eye Support Group, which to our knowledge is the only dry eye support group in the United States, was started, I think it was 12 years ago. And we, myself, Elaine, Sarah, and Doreen Iris, we started it because the Dr. Pirnazar from UCI, who had originated the dry eye support group at UCI, was leaving. So we've been doing this for the last 12 years now. We meet 4 times a year. We have doctors that are specializing in dry eyes to come and speak, and also a sponsor that will provide to help us financially with some of our expenses. So that's 4 times a year where people can actually learn how to treat these conditions.
I can recommend a few things that has helped me that I only found out from our dry eye support group. That would be that I had ocular rosacea. I didn't realize that I can't wear makeup, and I didn't realize that it extended to the eyes. And then also, I've learned that there are so many different types of dry eye, and how critical it is to find out which type of dry eye. I have the evaporative, which is related to the blepharitis, and that has been amazing to know which kind I have.
Elaine learned through her support group that an easy-to-use eye mask could relieve many of her symptoms.
I like the Oasis Rest and Relief Mask because it retains its cold temperature, so I can lie down and it makes my eyelids feel soothed, and when I stop using it, they feel more refreshed.
What I tell people when they call us for our support group is that to never give up hope, that there really is a lot out there that can be done, and to not give up trying.
Up next, the doctors of NVISION Eye Centers preview the next American Health Journal focus on eye health. Carrots can help improve your eyesight. True or false? The answer when we return. Carrots can help improve your eyesight. True or false? The answer is false. Carrots are an excellent source of vitamin A and beta-carotene, nutrients that eyes need to be healthy. But only a small amount is necessary for good vision. Among the topics the American Health Journal will cover on the next program for your eyes and vision, we'll find out about a procedure that can stop a sight-stealing disease.
One of the most exciting things that we're doing right now in our cornea practice is collagen cross-linking. This is just an amazing procedure because if we can detect people who have keratoconus at a very young age, we can actually offer them a medical treatment. It's a medical/surgical treatment that can prevent their cornea from getting worse, and it can arrest the keratoconus so it doesn't progress any further.
Then, cataracts are common in older people, but it's becoming seen more in younger people.
I'm starting to see younger and younger patients get cataracts. Some patients coming in with no family history of cataracts and no history of trauma are coming in their late 40s and early 50s having a diagnosis of a cataract that we need to do surgery on.
And a revolutionary procedure to help people see like when they were younger.
The procedure takes less than 10 minutes. It's entirely painless. The goal is to minimize or eliminate the need of corrective lenses. That happens as early as the first day. Sometimes it takes a few weeks for us to get the best results as far as vision.
The American Health Journal is brought to you by the National Healthcare Media Organization, bringing the latest in healthcare education to the American home. This program is sponsored by Body Metrics. Our performance monitor puts your well-being in the palm of your hand. Body Metrics provides vital health metrics in less than 30 seconds anytime and anywhere. Coming soon on the American Health Journal.
If they can just start out with even 10 minutes, 15 minutes, and it can be broken up during the day, it actually improves your health and actually protects you